So the history of influenza antivirals began in the 70s with the development of the M2 ion channels. Global resistance to this class of drugs led to looking for new agents, and targeted development led to the development of the neuraminidase inhibitors like oseltamivir, which are widely used for the treatment of flu.
But now we have oseltamivir, zanamivir. These are neuraminidase inhibitors, and we even have a newer drug class that includes Baloxavir. So several oral options.
What antivirals do is try to shut down production of more virus. It will do nothing for virus that's already made or infecting host cells. Hence the imperative to try to use it as early as possible.
As with all indications, the earlier the medication is started, the better the outcomes.
One thing that providers can do when providing flu vaccination is also to educate your patients that should they develop signs or symptoms of the flu, to reach out to their medical provider as soon as possible.
Many people wait until they've been ill for 3 to 5 days and call the doctor, and then the horse may be well out of the barn to really have a great impact from these antiviral medications.
Not before a couple years ago did I even know that there were antivirals.
I've never heard about antivirals for the flu from my provider or for anyone.
Most patients don't really know that there are treatments for the flu, and so they don't come in specifically asking for it. And so it's just the clinicians either not feeling the value of the therapy or not thinking about the need to treat patients that are otherwise healthy that likely is leading to underutilization of influenza therapies in clinical practice.
There is a prophylactic role for antivirals. Specifically, if there's someone who has influenza and exposes maybe a close contact that lives with them or works with them to influenza, giving the exposed individual doses early on has been shown in studies to reduce the risk of that exposed individual getting influenza.
Other people around you that can contract the flu from you, that could be deadly for them.
I want to protect my friends, my family, my colleagues, and if I can take a pill and be back at work and back living my life in just a few days, why not take it?
One of the unique features of Baloxavir is that a single dose is all that's needed to treat influenza. The advantage of this is if you have a patient that may not be compliant or doesn't want to take medications on multiple days, the medicine basically stays in the system.
There is a role for educating patients about antivirals at the time that they get their flu vaccine.
So if I had the flu and someone, my provider told me that there was an antiviral that could shorten the duration, I would, of course, be very interested.
I could go about my life. I could get back to work faster. I think in these times, we're really trying to look out for other people, not just ourselves. And that goes for COVID and for the flu.